Hi, my name is Dr. Paul Tucker with Texas Heart and Vascular, and I'm here to talk to you a little bit today about COVID-19 and how it might affect the heart. In most people, it probably doesn't affect the heart at all, but there are some patients who might be affected directly by the virus. It can cause an inflammation of the heart muscle called myocarditis. That's not very common, but it can happen. Most cases of myocarditis that are viral do end up getting better over time. You would need to be followed by a cardiologist if that happened, but that's very rare. Some other things that can happen that are more common is that the coronavirus can affect the respiratory system, cause pneumonia, cause low oxygen levels, and that can put a strain on someone whose heart muscle is already weakened. For example, someone who has a history of congestive heart failure, or someone who has a history of a previous heart attack, or knows already that they have a damaged heart. Some patients who have valve problems, like aortic valve or mitral valve disease, can also have significant leakage of their valves, which can lead to cardiac enlargement, not caused by the coronavirus, but it can be aggravated by the coronavirus. It is very important for cardiologists, as well as all physicians, but anyone who is taking care of critically ill patients, to practice all of the usual recommendations by the CDC. That includes personal protective equipment, keeping safe distance, meticulous hand hygiene, all of the things that you've heard about on TV. We are doing that in the hospitals whenever we are encountering anyone who might have COVID-19, but we're also doing that in general anyway. There's a lot of news right now regarding potential therapies, potential drugs that might be helpful, potential drugs you might be on that might theoretically make you at higher risk or lower risk for the disease. A lot of those things are myths and not true. What is true is that if you take certain medications that suppress your immune system, for example, chronic prednisone. There are a lot of medications that people take for various things such as rheumatoid arthritis, psoriatic arthritis, of course, cancer patients, that can affect the immune system in a negative way. That can increase your risk of having problems if you do get the COVID-19 virus. It is very important for those immunocompromised individuals to be especially careful about being around others in a medical setting, because your risk is higher of catching the virus as well as having a worse outcome if you do catch the virus and get sick. One of the issues that is being discussed right now is elective procedures. In general, procedures that are truly elective, such as hip replacements, knee replacements, plastic surgery, those are on hold for now until we get ahead of this virus. Other procedures that may not be emergent but are not elective would be things such as heart catheterization in someone who is having symptoms, a pacemaker in somebody who is having dizziness or lightheadedness or fainting. Those would be examples of urgent procedures, but not necessarily emergent procedures that could still be done under the current guidelines. For more specific concerns regarding what procedures might be elective or not elective, please talk to your primary care physician or your specialist, whoever is wanting you to have that procedure. Another phenomenon that's become very popular right now is the use of telemedicine, either communicating by telephone or by a video chat with your physician. We're doing it in our offices right now. In fact, we're doing it for the majority of patients because so many do not want to leave their homes and be exposed possibly to the virus. I think it's a great way of doing a patient visit. Of course, you miss out on the physical exam, but we can usually overcome that one deficiency by just taking a good history from you, going over your medications, going over your labs, going over any x-rays or imaging that you might have had in order to make a clinical decision about what next to do for you. So that's something that is available right now by many physicians, including us at Texas Heart and Vascular. One of the things I really want to convey to you in this short video message is that COVID-19 is not an insurmountable problem. It is a very surmountable problem. We will overcome it if we all do our part as physicians, patients, citizens, to take care of each other and to take care of ourselves, practice all of the CDC guidelines. We will get through this sooner rather than later.